Well, over the last 2 months, there's been a number of breakthroughs on the vaccine front in the fight against the coronavirus. Dr. Chad Rodgers, medical director for the Arkansas Foundation for Medical Care, offered his insights on how COVID-19 vaccine distribution may work. Let's talk a little bit more generically about how the clinical trial process for vaccines actually work. What is the kind of steps 1, 2, and 3?
Right, right. So the goal of vaccination, of course, is to, produce immunity to these diseases. But the number one thing that I think the FDA always puts in front is safety. So the safety part is very important. So these vaccines traditionally have gone through very rigorous testing and studying. It's usually, a process that takes several years. So initially, you sort of develop a vaccine and then you kind of try it in the first phase. It's usually on a small group of people to kind of see if it actually produces an immune response, if it's effective. And then it kind of moves on to a second phase where they kind of do a little bit more people, I guess you would say, and then people who may be affected by the disease so that you can see what their immune response is, sort of looking at safety and efficacy, and then moving into that third phase where you really do a huge trial of several thousand people. Again, looking at what's the immune response, how many people need to be immunized in order for it to be effective, and then what is the safety of that. So I think even what's real important to know is that even after the vaccine is released to the larger public, there's still trials that go on that they still study and follow and do surveillance on the safety and efficacy of the immunization, even after the vaccine is launched, when it goes to just, you're talking about millions of people. So we're kind of in a unique position with these vaccines because, there's several in the pipeline. We're seeing them kind of come through very quickly. They are in phase 1 and phase 2 at the same time, and phase 2 and phase 3 at the same time, trying to kind of see what those are going to look like, trying to get them to the public as quickly as possible and as safely as possible.
Should we be concerned about how quickly it's moving through this process from a safety perspective? I mean, you want time for the side effects to basically be seen is what you want that extra time for. We're not guaranteeing that at this juncture.
Well, I think, what I kind of generally think about is, I was describing to someone earlier, it's kind of like when Edison created the light bulb. And so there was a lot of technology and a lot of science going towards that. There were probably several people who could have developed the light bulb at the same time, but Edison got credit, right? So it's the same thing with science and vaccines and with drugs. A lot of technology and a lot of science that goes towards developing other drugs, gene therapy, drug therapy, that kind of go towards kind of the development of these vaccines. So we know, because of what we've learned before, that maybe, taking certain measures and doing certain research, that we can create things that are more safe, but it is sort of uncharted waters. I mean, even I kind of take a little bit of angst every once in a while, but really truly believe in vaccination and its impact and, what it can do in this new COVID environment. I mean, we're in sort of we're kind of getting to the point where cases are spiking and people are getting sick and people are dying, and we need to get to a vaccine quickly.
What is the percentage of the population that has to adopt this vaccine for it to have the type of effectiveness that you're talking about? And do you worry that, there is an anti-vaccine sentiment out there? There are people that are obviously clearly split politically on where they come down on COVID-19. Could all of this complicate us getting to that level?
Yeah, well, as a doctor, I certainly hate the fact that this is a political issue, because it's not a political issue. This is it's a real thing. It's a virus. I don't look at someone and I see them in practice and decide whether they're red or blue. I just decide that they're a human and that everyone is kind of equally affected by this disease. Although we do see, minority populations being disproportionately affected by the disease, which is a huge fact. So from vaccine to vaccine, it kind of depends on how much of the population needs to be immunized. I've seen lots of numbers. I think that people are kind of aiming for the goal of 80% or plus being at least having immunity or some sort of natural immunity by having had the disease. I think 60% is sort of the goal at this point, but we'll just kind of have to see. It's still kind of unknown. For measles, we know that when immunization falls below 80% that you start to see pop-ups of the measles disease. So again, it's sort of this area of unknown. We think the more people that are immunized, the better. I do see a lot of hesitancy, and so there's certainly a group of people who refuse vaccines, but there's a whole population of people who are just kind of hesitant. Like, I said, even I take pause for a minute about a new vaccine, but I mean, I'm going to get it. I'm going to get the vaccine. I look in the eyes of sick kids every day and don't know who has it and who doesn't. So I think for our healthcare workers and for people who live in long-term care facilities and stuff like that, we really need to prioritize them for vaccination. But what is that percentage point where we'll really start to see decline of the disease? That's sort of unknown. But I think you can kind of think in general, the 60% plus 80% would be a great goal. Of course, we'd love for everyone to get their flu shot.